Hi, I'm Dr. Mache Seibel. I've just come back from the North American Menopause Society National Meetings in Washington, D.C., and I want to share with you about a topic that was incredibly well attended there, and a discussion that was led by Dr. Murray Friedman from the Medical College of Georgia, and Dr. Raquel Arias from the University of Southern California. The topic was on when sex hurts. Now, this is an incredibly important and common issue in menopause because it turns out that 10 years into menopause, the most common symptom of menopause is dryness and thinning of the vaginal tissues and the intimate tissues in the lower urinary tract and the skin and area just outside of the vagina. This is the #1 symptom of the 400 million women worldwide who are in menopause. And the problem is that as a result of not enough estrogen, either because of natural menopause or for women who have cancer such as breast cancer, who have to go through chemotherapy, or they have to go through medications such as raloxifene or tamoxifen or aromatase inhibitors in particular, these medicines are going to eliminate or dry down the amount of estrogen so that the tissues in the vaginal area and around the outer part of the bladder become so thin and so narrow that it leads to urinary symptoms, burning, dryness, and painful intercourse. Now, the thing that was intriguing about this meeting is that how fast it happens. Within a matter of just 3 months, the tissues lose their elasticity, and pictures were shown of women who didn't get treated with estrogen locally, and the tissue would just naturally shrink up. The urethra would stick out because the vaginal tissues were beginning to shrink, and that's what leads to those urinary tract symptoms. So, if you can use local estrogens, but you have to realize some estrogen will be absorbed into the bloodstream, so you do have to talk with your doctor. There's also an over-the-counter product called Replens, which is non-hormonal and does allow the moisture to come back into the vagina and maintains the vaginal pH, the level of acidity, at a more physiologic level. Well, this information will be very helpful for you. It's important to discuss this information with your doctor as you approach menopause, or if you're going through treatments for breast cancer or similar kinds of cancer where you have a reduction in estrogen. For a lot more information on menopause, on sexual dysfunction, on vaginal dryness, and for a free ebook on how to take estrogens, if that's something that you can or want to take, go to my website, www.drseibel.com, DOCTORSEIBEL.com/menopause. You'll find a lot of information that will help you there.